A silent threat. 8 signs that could indicate osteoporosis. Osteoporosis, medically known as osteopenia, is a silent but potentially debilitating condition characterized by weakened bones and an increased risk of fractures. This bone-thinning disease often goes undetected until a minor fall or sudden impact causes a bone to fracture. It primarily affects the elderly, but can begin to develop much earlier in life. The condition is often termed a silent disease because it can progress without any symptoms until a bone breaks. Osteoporosis affects millions worldwide and is particularly common among postmenopausal women due to hormonal changes that affect bone density. However, men are not immune to this condition and can also experience significant bone loss. Risk factors for osteoporosis include genetics, insufficient calcium and vitamin D intake, a sedentary lifestyle, excessive alcohol consumption, smoking, and certain medications. These factors contribute to the weakening of bones over time, making them more susceptible to fractures. The impact of osteoporosis is profound. Not only does it increase the risk of fractures, but it can also lead to chronic pain, loss of height, and a hunched posture. This in turn can affect mobility, independence, and overall quality of life. Despite its prevalence, osteoporosis can be managed and even prevented with lifestyle changes and appropriate medical treatment. Furthermore, understanding the early warning signs of osteoporosis is vital for prompt intervention and management. Early detection can lead to more effective treatment strategies, helping to maintain bone density and reduce the risk of fractures. Simple lifestyle changes, medications, and supplements can make a significant difference in managing the condition and preserving bone health. Recognizing these early signs is key in taking proactive steps towards bone health and preventing the severe consequences of this condition. The first indication of osteoporosis is a decrease in height over time. This sign can be subtle and often goes unnoticed until it becomes quite pronounced. The loss in height is typically due to the weakening and compression of the spinal vertebrae. As the bones become more porous and fragile, they can compress or fracture, leading to a reduction in stature. Regular monitoring of one's height, especially for those at risk, can provide early clues to the onset of osteoporosis. The second sign is the occurrence of unexpected fractures. Osteoporosis can weaken bones to the point where they break more easily than normal, even from minor stresses. Common fracture sites include the hip, wrist, and spine. These fractures can occur from seemingly innocuous actions, such as bending over or coughing. Often, these fractures are the first clear indication that someone has osteoporosis, highlighting the importance of preventive bone health measures. Sign 3 is a change in posture, often described as a stooped or hunched back. This change, medically known as kyphosis, occurs due to vertebral fractures and weakening of the spinal muscles. The curvature can lead to a noticeable change in appearance and can also cause back pain. This altered posture can also impact balance and mobility, increasing the risk of falls. Returning to sign number 4, we have the onset of back pain. This pain can be due to fractured or collapsed vertebrae and can range from mild to severe. It is often a persistent pain that doesn't go away with rest. The nature of this pain can significantly affect daily activities and quality of life, making early diagnosis and management essential. Symptom number 5 is a decrease in grip strength. Osteoporosis can affect the bones in the wrists, leading to a reduction in hand strength. This might become noticeable when performing tasks that require gripping, such as opening jars. This reduction in grip strength can also be a risk factor for falls, as it affects the ability to hold onto objects or support oneself. Sign number 6 involves brittle fingernails. While not as direct as other symptoms, brittle nails can be an indicator of general bone health. If you notice that your nails break more easily than before, it might be worth considering a bone density test. Changes in nail health can sometimes reflect changes in bone density, making it a subtle but useful indicator. The 7th sign is receding gums. As the jawbone loses density, gums can recede and teeth may become loose. This is because the jawbone is susceptible to the same bone loss as other parts of the body. Dental health can therefore provide important clues about overall bone health, and regular dental checkups can help identify problems early. The 8th and final sign is a decrease in overall fitness level. As osteoporosis progresses, it can lead to a reduction in physical activity due to pain or fear of fractures, further exacerbating bone loss and muscle weakness. Maintaining an active lifestyle, within safe limits, is crucial for bone health, and a decrease in fitness levels can be both a sign and a consequence of advancing osteoporosis. If you exhibit any of these symptoms, it's imperative to consult a healthcare professional and request a bone density test, known as a DEXA scan. A DEXA scan is a specialized X-ray that measures bone mineral density and helps diagnose osteoporosis. This test can reveal how dense and strong your bones are, which is crucial for assessing fracture risk. The DEXA scan is a quick, non-invasive procedure that typically focuses on high-risk areas such as the hip and spine. It exposes the patient to minimal radiation and is more precise than a regular X-ray. Results from a DEXA scan are usually available shortly after the test, providing a clear and immediate understanding of bone health. Fortunately, osteoporosis is a manageable condition. To address it, let's explore 6 lifestyle modifications that can enhance bone health, reduce the risk of fractures, and aid in managing osteoporosis. First, increasing calcium and vitamin D intake is vital for bone health. Calcium is essential for maintaining strong bones, and vitamin D aids in its absorption. Incorporate calcium-rich foods like dairy products, leafy green vegetables, and fortified foods into your diet, and ensure adequate vitamin D through sunlight exposure, certain foods, and supplements if necessary. Regularly consuming these nutrients can significantly decrease the risk of osteoporosis and related fractures. Second, engaging in regular weight-bearing and muscle-strengthening exercises is crucial for building and maintaining bone density. Activities like walking, jogging, climbing stairs, and resistance training not only strengthen bones but also improve balance and coordination, reducing the risk of falls, which is particularly important for individuals at risk of osteoporosis. Consistent exercise is one of the most effective ways to combat bone density loss. Third, avoiding smoking and limiting alcohol consumption is critical for maintaining bone health. Smoking has been shown to impede bone healing and decrease bone mass, while excessive alcohol intake can interfere with the body's ability to absorb calcium. By quitting smoking and moderating alcohol intake, individuals can significantly improve their overall bone health and reduce the risk of osteoporosis. Fourth, maintaining a healthy weight is important for bone strength. Being underweight can increase the risk of bone loss and fractures, while being overweight can place additional stress on the bones. Achieving and maintaining a balanced weight through a healthy diet and regular exercise is key to preventing osteoporosis and its complications. Fifth, ensuring safety in daily activities to prevent falls is essential for individuals with osteoporosis. Falls are a leading cause of fractures in people with weakened bones. Simple home modifications, such as removing trip hazards, improving lighting, and wearing supportive footwear, can significantly minimize the risk of falls and related injuries. Sixth, considering medication or supplements as recommended by a healthcare provider can be an important part of managing osteoporosis. In some cases, medications that help strengthen bones might be necessary, and supplements like calcium and vitamin D can be beneficial, especially for those who might not get enough from their diet. Discussing these options with a healthcare professional can help determine the best approach based on individual needs and risk factors. By adopting these lifestyle changes, individuals can significantly improve their bone health, reduce the risk of osteoporosis-related fractures, and maintain a better quality of life. These measures should be viewed as complementary to, not a replacement for, medical treatment and advice from healthcare professionals. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.